Sleep is not merely a period of inactivity. It is a fundamental biological imperative. Like breathing, eating, and drinking, sleep is essential for survival and optimal functioning. It is a complex, highly organized state that actively restores and rejuvenates the body and mind. Many individuals mistakenly believe they can thrive on minimal sleep, often boasting about getting by on 4 or 5 hours. This notion is a dangerous myth. Chronic sleep deprivation accumulates a significant sleep debt, leading to profound negative consequences for health and performance. Insufficient sleep profoundly impacts cognitive functions, impairing memory retention and recall. It significantly alters mood, contributing to irritability, anxiety, and even depression. Furthermore, a lack of adequate sleep severely compromises the immune system, leaving the body vulnerable to illness. Sleep is not a monolithic state, but a dynamic progression through distinct stages. Non-rapid eye movement, or NREM sleep, comprises 3 stages, each progressively deeper. NREM stage 1 is light sleep, a transition from wakefulness. NREM stage 2 is characterized by a slowing heart rate and a drop in body temperature, preparing the body for deeper rest. NREM stage 3, often called deep or slow-wave sleep, is the most restorative phase, crucial for physical recovery and growth. Rapid eye movement, or REM sleep, is distinct from NREM. During REM, brain activity increases, resembling wakefulness, and most dreaming occurs. Muscles become temporarily paralyzed, preventing us from acting out our dreams. A complete sleep cycle, encompassing all NREM stages and REM, typically lasts between 90 and 110 minutes. We cycle through these stages multiple times throughout the night, with the proportion of deep and REM sleep shifting as the night progresses. Deep sleep is vital for cellular repair, physical restoration, and the release of growth hormone. REM sleep is critical for emotional processing, memory consolidation, and learning. Both stages play indispensable roles in maintaining overall health and cognitive function. The circadian rhythm is our internal biological clock, a natural internal process that regulates the sleep-wake cycle and repeats roughly every 24 hours. It dictates when we feel alert and when we feel drowsy, influencing numerous physiological processes. This rhythm is primarily regulated by light exposure and the hormone melatonin. Light, particularly natural daylight, signals wakefulness and suppresses melatonin production. As darkness falls, melatonin levels rise, promoting sleepiness. Maintaining a consistent sleep-wake schedule, even on weekends, is paramount for optimizing circadian rhythm function. Regularity reinforces the body's natural timing, leading to more efficient and restorative sleep. Deviations can disrupt this delicate balance. Modern life presents significant challenges to our circadian rhythm. Jet lag, caused by rapid time zone changes, disorients the internal clock. Night shift work forces individuals to operate against their natural rhythm. Social jet lag from inconsistent weekend sleep also contributes to chronic misalignment. Sleep plays an indispensable role in memory consolidation, transforming new information from short-term to long-term storage. During deep sleep, the brain replays and strengthens neural connections formed during the day, solidifying learning and recall. The glymphatic system, a waste clearance system unique to the brain, becomes highly active during sleep. It flushes out metabolic waste products, including amyloid beta proteins, which are implicated in neurodegenerative diseases. This nightly cleansing is vital for brain health. Chronic poor sleep is increasingly linked to an elevated risk of neurodegenerative diseases. Insufficient sleep can lead to the accumulation of toxic proteins in the brain, contributing to the pathology of conditions like dementia and Alzheimer's disease. Prioritizing sleep is a proactive measure for long-term brain health. The impact of sleep extends profoundly to cardiovascular health. Chronic sleep deprivation elevates blood pressure and increases heart rate, placing undue stress on the cardiovascular system. Adequate sleep is a protective factor against heart disease and stroke. Sleep is a cornerstone of a robust immune system. During sleep, the body produces and releases cytokines, proteins that target infection and inflammation. Insufficient sleep weakens the immune response, making individuals more susceptible to colds, flu, and other infections. Sleep significantly influences metabolism and weight management. Lack of sleep disrupts the balance of hunger-regulating hormones, increasing ghrelin, which stimulates appetite, and decreasing leptin, which signals fullness. This hormonal imbalance often leads to increased caloric intake and weight gain. Furthermore, chronic sleep deprivation impairs glucose metabolism and reduces insulin sensitivity. This metabolic dysfunction significantly increases the risk of developing type 2 diabetes. Prioritizing sleep is a crucial component of metabolic health and disease prevention. Sleep profoundly influences the delicate balance of key hormones. Cortisol, the stress hormone, is typically lowest during early sleep and rises towards morning. Sleep deprivation elevates evening cortisol levels, promoting wakefulness and anxiety. Melatonin, the sleep-inducing hormone, is produced in darkness and signals the body to prepare for sleep. Growth hormone, essential for tissue repair and muscle growth, is primarily released during deep sleep. Disruptions to sleep directly impair these vital processes. The connection between sleep and reproductive hormones is significant. In men, insufficient sleep can lower testosterone levels, impacting libido and muscle mass. In women, sleep disruption can affect estrogen and progesterone, influencing menstrual cycles and fertility. Poor sleep significantly disrupts insulin sensitivity, making cells less responsive to insulin's effects. This leads to higher blood sugar levels and increased demand on the pancreas, contributing to insulin resistance and a heightened risk of type 2 diabetes. While the fundamental need for sleep is universal, there are subtle differences in sleep needs and patterns between men and women. Hormonal fluctuations throughout a woman's life, such as during menstruation, pregnancy, and menopause, can uniquely impact sleep quality and duration. The link between poor sleep and mood disorders is undeniable and bidirectional. Chronic sleep deprivation can exacerbate symptoms of depression and anxiety, while these conditions often disrupt sleep patterns, creating a vicious cycle. Insomnia, characterized by difficulty falling or staying asleep, often has significant psychological triggers. Stress, anxiety, and rumination about daily problems can activate the nervous system, making relaxation and sleep elusive. Addressing these triggers is crucial for recovery. Sleep plays a critical role in emotional regulation. During REM sleep, the brain processes emotional experiences, helping to temper reactivity and promote emotional resilience. Insufficient sleep can lead to heightened emotional responses and difficulty managing stress. Cognitive behavioral therapy for insomnia, or CBTI, is recognized as the most effective long-term treatment for chronic insomnia. It addresses the underlying thoughts and behaviors that perpetuate sleep problems, teaching individuals strategies to improve sleep habits and reduce sleep-related anxiety. Numerous factors in our modern environment can disrupt healthy sleep. Exposure to blue light from electronic devices before bed suppresses melatonin production, delaying sleep onset. Caffeine, even consumed hours before bedtime, can interfere with sleep architecture. Alcohol, while initially sedating, fragments sleep later in the night. Heavy meals close to bedtime can cause digestive discomfort. Noise pollution, whether from traffic or neighbors, can awaken sleepers. An overly warm or cold bedroom can prevent comfortable rest. Chronic stress and an irregular sleep schedule are also potent disruptors. Identifying and mitigating these factors is the first step toward better sleep. Establishing a consistent evening wind-down ritual signals to your body that it's time to prepare for sleep. This might include reading a physical book, taking a warm bath, or practicing gentle stretching. The bedroom environment should be optimized for sleep, cool, dark, and quiet. Remove all electronic devices, including televisions and smartphones, to eliminate blue light exposure and the temptation for late-night scrolling. Consistency in your sleep schedule is paramount. Go to bed and wake up at the same time every day, even on weekends, to reinforce your circadian rhythm. While not a substitute for good habits, certain supplements can be considered under guidance. Melatonin can help reset the sleep-wake cycle, magnesium may promote relaxation, and herbal teas like chamomile can have calming effects. To truly understand and improve your sleep, consider tracking your sleep patterns. This can involve simply noting your bedtime and wake time, or using wearable devices to monitor sleep stages and quality. This data can reveal trends and help identify areas for improvement. Embarking on a 30-day sleep challenge can be a powerful way to solidify new habits. Commit to a consistent sleep schedule, a nightly wind-down routine, and avoidance of disruptors for a full month. This dedicated period can reset your body's internal clock and establish lasting positive changes. Finally, recognize when professional help is needed. If persistent sleep problems significantly impact your daily life, or if you suspect an underlying sleep disorder like sleep apnea or restless leg syndrome, consult a healthcare professional. A sleep specialist can provide diagnosis and tailored treatment plans to ensure you achieve the restorative sleep you deserve.